We are here for yet another episode, and this is episode 3 with a repeat guest. Those who watched our first episode know her. She's called June, and she's here again to teach us something else. Utaji introduce tena.
Hey people, my name is June. If you saw the other video that I was featured on by Justin, you probably know who I am, what I do, so I will not go back into that. If you want to know more about me, just go back to the previous video so that you get to know why I'm here. Thanks.
Thanks. Okay, so today's episode is on a topic called Placenta Previa. I'm sure June is here to help, and we'll get to learn more about it and how it affects people through her.
Yeah.
So maybe if you just tell us what Placenta Previa is.
Okay, thank you. So Placenta Previa, it is the point in pregnancy after conception, and we do understand the minute after conception, there's also the bit where the placenta attaches to we call it the fundus of the uterus.
Mm-hmm.
That's the upper bit part of the uterus, so it attaches. But now you find that the placenta attaches outside the fundus of the uterus.
Mm-hmm.
So that is what we called placenta previa.
Mm-hmm.
Yeah.
So basically the attachment is at the wrong place.
Yeah, basically what happens is, or usually the placenta has to attach on the fundus or the upper part of the uterus,
Mm-hmm.
right? But now you find that the placenta didn't actually do that, so it attached probably on the lower part of the uterus, or
Mm-hmm.
on the side, so it is not in the normal bit where it should attach. Yeah.
Does it make the pregnancy viable?
It does, but it also depends.
Mm-hmm.
Yeah, it also depends. Well, under strict monitoring, the pregnancy is viable.
Mm-hmm.
But then again, after, or when we are almost delivering this baby,
Mm-hmm.
you have to be under close monitoring.
Mm-hmm.
And also another thing to note, once you've been diagnosed with this condition,
Mm-hmm.
it probably means that your doctor might recommend complete bed rest,
Mm-hmm.
so as to avoid the pregnancy or miscarrying or having an abortion.
Mm-hmm.
Yeah, so what happens is you will be under close monitoring by your OBGYN. So in case of this, it's usually good to always start your clinics as early as possible,
Mm-hmm.
so that the first ultrasound will tell us where the implantation has taken place.
Mm-hmm.
Mm-hmm.
So, like, what are are there types of this particular condition?
Yeah, there are different types of these conditions.
Mm-hmm.
And another thing that I would want to say, it would really depend where the attachment did happen, right?
Mm-hmm.
So we do have one where there's a normal, the baby has assumed the normal position, but you find that the placenta has attached way past the fundus of the uterus.
Mm-hmm.
We do have a bit of now the second bit where the placenta has attached on the lower bit of the uterus, but
Mm-hmm.
now on the side, and then it doesn't cover the cervical os,
Mm-hmm.
or the cervical, how do we call it? Os, it's like a shimo or
Oh yeah,
opening.
so it go open.
Exactly.
Mm-hmm.
Alafu we have the bit where it attaches, yes, on the lower part, and then it
Mm-hmm.
slightly covers the cervical os or the cervical opening, and then we do have the fourth type where the placenta attaches on the lower bit of the uterus, and it
Mm-hmm.
actually covers the whole cervical os or the opening. So, like in such a case, that would mean normal delivery wouldn't really be required.
Mm-hmm.
You'll probably go for CS.
Oh, so the severity depends on the type.
Yeah, yeah. So the severity will determine which form of delivery your OBGYN or your doctor will advise. Yeah.
And for the risk factors, what are the risk factors or what causes placenta previa?
Yeah, well, for the placenta previa, one thing I would want to note is that maternal age really plays a big role in this. When you have advanced age of more than 35 years, this would lead to this. If you've had a previous history of surgeries, for example, even a C-section, and maybe let's talk about the uterine fibroid removal, this would equally be a risk factor of the placenta previa. Yeah.
Does it have like a specific cause, or occurrence of it depends on the risk factors?
Yes. Yeah. So we really can't. I can't point that this is actually what causes it, but we do have those risk factors that may lead to the placenta previa.
But are there any visible signs?
Yes.
For placenta previa?
Yes.
Please.
Yeah. So well, in placenta previa, if you notice, like, you're pregnant and you're having bright red blood coming out, or rather you're bleeding bright red. So with bright red, this is a classical sign to indicate that you have placenta previa. And also,
how far into the pregnancy? Because I understand there's also the implantation bleeding, which is also bright red.
Yeah. Well, with the implantation bleeding, that really happens quite early in pregnancy when there's that implantation. So, and then you will also notice that with the implantation, the blood is slightly of spotting, and it's not much as opposed to placenta previa. And then another cardinal sign to also check that would make you suspect that you have placenta previa, you do have the bright red bleeding, and then there's no pain. You're not feeling any pain at all. Yeah.
No contractions, no cramps.
Yeah, and this majorly happens in the second trimester, as opposed to now the implantation, which happens in the first trimester. Yeah.
Then, apart from the bleeding, any other signs?
That is usually, the major sign for placenta previa.
So, if you experience bleeding in your second trimester when pregnant, you have to go for checkup.
Yeah, you have to go to checkup. And also, you know, there's a difference between placenta abruptio, which we'll probably talk about it in another day. So you see, with placenta abruptio, the blood is usually dark red. But now the cardinal sign for placenta previa, it is bright red, and you're not feeling any pain. Yes.
Is it heavy or very light?
It will also depend on the type of placenta previa that we have. Yeah.
So the symptoms, the quantity and thickness of the blood will vary with the type of previa.
Yeah. But it's usually much when, as opposed to maybe the implantation or
And how is it diagnosed?
The first things first, when you're bleeding. So with that, we'll have to go. You'll have to go to the hospital. If the doctor really needs to check on that, an ultrasound might be recommended. And then we usually discourage. Us as healthcare providers, we usually don't do the digital exam where we use our two fingers to to insert and check, because that might cause more problems. So we might consider a vaginal a speculum exam, but also looking at after trying to see which type of placenta previa it is. But mostly we really discourage using digital exams as much as possible.
Are there any blood tests? Because I understand when you are expecting, you go for blood tests during the first few months. Could that maybe help the health provider or if you have placenta previa without the scans?
I think for blood tests, when you start off your antenatal profile, what we usually check for is we try to look for venereal diseases such as syphilis. We check for HIV. We try to check for your blood level. So one thing maybe the blood test will check for it is the blood level, just to see whether you're having anemia or it has severed. Yeah. But other than that, the blood test really can't help in diagnosing. The same way you'd use a blood test and it will tell you that this blood test has high levels of HCG hormone to ascertain that you're pregnant. We really don't have that much with placenta previa. Yeah.
So you really have to depend on your health provider.
Yeah, so your health provider would advise you to go do an ultrasound so that at least we have we are able to see what is really happening in the uterus.
Okay. And once you are diagnosed with placenta previa, what are the steps you can take to manage, say, the severity or to avoid further complications?
Your doctor will probably advise you on total bed rest. Yeah. So we will put you under bed rest, and if the condition is severe, then probably we see you might deliver soon. So we might want to mature the baby's lungs before they get here. So you might be put on corticosteroids. Yeah.
So bed rest basically also helps with managing the risk.
Yes.
For your pregnancy.
Yes. So most of the times you'll be put on complete bed rest. That means movement.
No movement.
Exactly.
Or helped to the toilet.
Well, you can make a few steps to the toilet, but we don't want you, straining. Remember, the implantation has taken place in the
wrong place.
Yeah, in the wrong place. So we don't want to cause further complications.
Okay. What actions would be taken by someone with placenta previa to minimize risk? You said bed rest. Are there foods that someone should avoid? Are there medications that someone should avoid?
Well, we do have drugs such as aspirin, which falls in the NSAIDs, and ibuprofen. So with these drugs, they usually increase the level of bleeding. So your doctor might ask you to
not to take
this. So there are particular drugs the doctor might advise you not to take. And then you see, since you're bleeding and this has affected your blood level, the doctor might advise on foods which are rich in iron in order to compensate for the red blood cells, and also increase the RBC's stores to boost your blood levels.
Okay. So I understand that if you have placenta previa, it might affect your birth plan.
Yes.
Does this apply in all the types? There are types that you can eventually have a normal delivery.
In type 1, normal delivery might be imminent. Yes. But now in type 3, where we have in type 4, where the cervical os has completely, implanted on the cervical os, that will increase the chances of losing your baby. So in such cases, you'll be advised to go for cesarean section. Yeah.
So monitoring should be constant for someone with placenta
Very close
previa.
monitoring is needed in placenta previa.
How does placenta previa affect? Okay, let me rephrase. In cases of placenta previa, are there risks associated with either? How would placenta previa affect your child?
I think the only bit that can affect your child is probably losing the baby, and if this was not managed early and in developing an inappropriate birth plan. But other than that, there's nothing much that should affect your baby.
Does it?
So long as there's that implantation, your baby should be getting enough nutrients, right? Because you're eating healthy. So eating healthy is also advised. Eat healthy, so that to ensure that your baby is equally getting enough nutrients for growth.
And also you have to avoid like strenuous activities, right?
Exactly. And in some instances, in severe cases of this form, you would even be advised against sexual intercourse activities because this might cause stress on the cervical os. So
Does it affect future pregnancies? Like once you had placenta previa, say you gave birth either normal delivery or CS, would it affect your future pregnancies? Is there a possibility that you develop the condition again?
Yeah, you might develop the condition again. That's why we talked about when you've had a previous delivery of such a case. So chances are there might be a repeat.
A high percentage?
I really can't say that. I really can't put a percentage on that, but there's usually a risk factor of due from a previous delivery or surgery such as cesarean section.
Okay. So my last question would be, are there any preventive measures to prevent the risk of developing placenta previa? I think this would be referring to someone who isn't pregnant yet, because you wouldn't know if you might develop placenta previa during your pregnancy. Do you know?
Well, I've just confirmed there's nothing really. I just wanted to be sure that I'm giving out the correct information. So there's nothing really you can do in order to prevent this condition. I mean, we just pray that once you conceive, the implantation takes place at the right point. If things goes otherwise, we will need to probably start your clinic as early as possible, be under close monitoring, in order to ensure that the pregnancy is viable until term. Other than that, there's no way to really...
nothing much to do about it. I feel like this is a very complicated condition to find out you're in that position and to know that you're not the cause, and you also can't do anything about it or to prevent it.
I mean, you see, nobody really gets pregnant with the hope that
things will go wrong.
We really hope that things will go okay, right? But we also have those cases where things just don't go the way we expect them to be. So the only thing I would urge a woman is to be positive and also start, mental health is quite... You see, one thing we fail to understand is that a lot of things really affect our mental health state. So also being in such a condition, just take quick precautions. If you need to be seen early, please do so, and understand it is not your fault. And I think the best way to go about maybe issues that we have is to try and find what else can work, or what else would reduce the severity rate of whatever we are going through. So
I think it's also important for the earlier you find out that you've conceived, you should start your clinics immediately, because some of these things can be pinpointed earlier rather than later into the pregnancy when you've started experiencing more complications. Does it cause pain?
No, there's no pain. There's no pain.
So from the outside, the pregnancy
normal.
Grows normal.
The pregnancy will grow normal. The only thing that will make you, be fearful that things are not right. I mean, my second trimester, I am seeing bright red blood, and it is painless.
And if you're a person to just assume and take things lightly.
Please don't.
You'll assume that it's because I've seen people who say they've bled throughout their pregnancy. How does that happen? What's the cause of that? Because
it could be due to trauma. Could be you having the placenta previa. There are other people who are probably bleeding the dark brown. That is placenta abruption, but with that you feel pain. Yeah, maybe we will probably cover placenta abruption in a different time.
I'll sure invite you for that one.
Yeah,
I'll sure invite you for another.
Yeah, so things might cause that bleeding. Yeah. Yeah, so other than that, I would advise us to start clinic early. According to WHO, we have focused antenatal clinics that are usually scheduled into 4 visits. You are supposed to be seen at least 4 times in your normal pregnancy. But now, once you set your clinic early and then you notice things are not going the way they ought to be, we now plan on how best to help you until the end of pregnancy. I mean, the goal for us as a healthcare provider, for you as a woman, is to have a healthy baby at the end of the day, and we really want to help you to achieve that. Yeah. And then another thing, like, I know us as women, the more you grow up, you now tend to notice that getting pregnant and getting through the 9 months of pregnancy, it's not as easy as we think. Like, it is 1, 2, 3. A lot might happen along the way. So yeah, just always be open, and also in case you notice anything, just take precautions as early as possible.
Then I think it's also important to always be ready to go see your healthcare provider when you sense some of these things, because when you assume that I had this happened and nothing went wrong from someone else, you never know what your issue is.
You never know.
That was quite educational. I had zero idea on placenta previa, and thank you so much for educating us on it.
Anytime, any day.
Anytime, any day. I'll call you here tomorrow.
Please do. Just make sure I have that time to be here. I will.
Anyway, thank you so much for coming.
Anytime.
You've graced our channel for a second time.
Thank you.
I hope we'll be seeing more of you.
Definitely.
Okay, so thank you for coming.
Alright, thank you.
Thank you for educating us.
Thank you.
That was the end of our session. Until next time, bye. Don't forget to ask any questions you might have on the topic down on the comments.
Yeah.
June will answer. She'll be in the comments responding to you.
Yes, I will. And please go support her, like, subscribe. What else do we normally say? Turn on the notification.
Share.
Yes, please do that.
Okay, thank you. Have a good day.